All right, so I'm not super flexible, but that's why I put the word modified. I'm trying to do a pigeon. So I can do it lateral, I can do it before inferior, facing away from it, but I'm looking around like, what is that sound coming from my body? So you're just trying to encourage that external rotation, that flexion, and what's really cool too, in the beginning they'll say, when you're doing the stretches and the exercise and some of the immobilization, they're going to feel that kind of capsular, that pinch, that impingement, right? And you got to make sure it's not a bony impingement. You don't want to jam bones against each other. But if you know it's a capsular thing and they're having pain because of that joint, that pressure, what's really cool is you tell them that you want them to feel that 1 or 2 or 3. And as they're working through it, then all of a sudden they start to say things like, hey, I'm starting to feel my butt stretch a little bit when I'm doing that 1. And then you're making progress. You want to tell them that you're going to try to take these stretches that don't feel like stretches and turn them into stretches. And that's, they don't have to ask you, am I getting better? You just ask them what they're feeling and they tell you they're getting better, and that's really fun. I get those emails at 2 in the morning, I feel my butt stretch, I felt my butt stretch. All right, so here's inter-rotation. On this particular one, I'm just sort of doing an active falling. You want to walk that right foot out. But what I really, you want to walk that out so it doesn't just turn into like a spinal rotation. But what's better is take that foot and cross it over, externally rotate the other one and use the weight of them like you're doing the stretch to encourage that down. I'm not sure why I didn't do it here, but that's what I generally do. And then golfers, right? Whether it's a takeaway leg or your follow-through leg, if a golfer has OA, they will do anything you tell them, by the way. But basically, you get the idea. You can do that for external rotation too, but just have them put that around there, get a really strong pull, and have them just rotate through there and make sure they're not just twisting their spine, right? But they're actually rotating through. That's really fun. All right, same thing with external rotation, right? You get the idea. Just go through there. You can do it kneeling on a stool, like the little, roller stools, whatever. And you can spin that too. You can do the try not to do a strengthen if you want to. All right, I could put, so we can start making things up. I could have on either leg, I could go up like this, and I could lunge into a flexion over here and have the band pulling. I could have put it here and done extension on this side. I've never done 2 at the same time, but that'd be cool. Dangerous. Deadlifts, good morning squats. I treat a lot of bodybuilders. These guys are just massive beasts of humans, and they have to go to this crazy deep, totally unhealthy squat, but that's what they do. And they'll come and say, yeah, I can't squat, I'm just, I'm trying to turn my feet out as much as I can, but it's still hurting. And then you hook the band to them and just have them do a bunch of squats. Put them in the position they can't do, give them a little bit of whatever's happening, proprioception, joint mobilization, capsular stretch, whatever you believe is happening during this stuff, and have them just do that, and then have them take it off and squat again, and their eyes just they'll follow you like a cult leader anywhere you want to go. It's great. Golfers and bodybuilders and runners.
What an interesting cult.
It's a healthy kind of cult. You're only limited by your own imagination. Go to YouTube and get crazy. All right, so long axis traction. When people come in, you're trying to figure out, do they have back pain? Is it an extra-articular problem? Is it an intra-articular problem? And if they have OA, and you'll do, can you guys see that okay? You can make that go at any level. You can go, start in more flexion if you want to be a little bit looser or a little bit more comfortable. Chase them down to extension.